Hi all, in this short video session, I am going to discuss with you a very important topic. This is regarding the current epidemic of diabetes in India and also in the world. Is it genetic or lifestyle mediated? This is a big question which we need to answer. If you see the epidemiology of diabetes in 1980 and in 2014, the studies published in Lancet 2016, we can see the number of patients living with diabetes in 1980 was 11.9 million in India into 1980. In 2014, there is nearly 6 times increase in the number and it is now 64.5 million. So there is a 6 times increase in the number of individuals living with diabetes in just 35 years. Such a big proliferation in the number, which is very alarming, and we need to know what exact is the driving force for this epidemic. If you consider type 2 diabetes, which is the most common form of diabetes, there is a very strong family history. The lifetime risk of developing type 2 diabetes mellitus is 40% for an individual if he or she have one parent with type 2 diabetes and 70% if both parents are affected with diabetes. Concordance rate of type 2 diabetes in monozygotic twins is 70%. So definitely there is a very strong family history. With this background, I am going to give a MCQ question regarding the etiology of type 2 diabetes mellitus, which is true. Lifestyle is equals to genetics, lifestyle more than genetics, lifestyle more important than genetics, genetics more important than lifestyle, genetics more important than lifestyle. You can select an answer. We will discuss the answer after a few slides. Genome Wide Association Study, which study all the total gene pool, they found 38 genetic variants associated with type 2 diabetes. But these risk alleles identified to date can only explain about 10% of the observed heritability of type 2 diabetes. We already told that there is a strong family history, but only 10% of the strong family history could be explained by the genetics as of now. Another fact in this background I need to share with you is, in early 1970s, ICMR conducted a study and the overall prevalence of diabetes was 2.1% in urban areas and 1.5% in rural areas. Now the prevalence is 7.1%. There is a 350% increase in the prevalence after one generation. Such a big jump in the prevalence, 350%. We all need to understand or recollect the Hardy-Weinberg law of genetic equilibrium. What this law states is alleles and genotypes, frequencies of alleles and genotypes in a population will remain constant from generation to generation if the population is stable. That means no significant migration or immigration, and there will be a genetic equilibrium. So going back to the slide, after one generation, there was a 350% increase in the prevalence of diabetes. If genetics is the main driving force, the gene pool responsible for the diabetes should also increase by 350% or correspondingly high proportion after one generation. But this cannot happen according to the Hardy-Weinberg law. Gene pool or frequency of alleles and genotypes in the population will remain the same. These genes cannot proliferate like this. So only way we can explain this severe surge in the prevalence is only lifestyle. But we found that there is a strong family history. Then what are we inheriting? Now I am telling that genetics only contribute to 10%. But then what is the reason for the high or significant family history which we observe regarding type 2 diabetes? Actually, we are not inheriting the genes, we are inheriting the same lifestyle practices from the parents. If I am born and brought up in a family where my parents are not following a healthy diet and lifestyle practices, I am seeing this, observing this, and practicing this unhealthy lifestyle practices from the early childhood, and I will also become a diabetic like my parents. So we are inheriting the same lifestyle practices. It is not the gene that we inherit that matters more. It is the same lifestyle practices which we acquire from our parents, which is more important, and this is the exact or correct reason for the high heritability of type 2 diabetes which we observe. Additionally, epigenetics also play a role. What is epigenetics? Environment can influence the expression of genome through methylation of DNA, post-translation modification of histones, activation of microRNAs. If parents follows unhealthy diet and lifestyle practices, there can be changes in the genetic material in the sperm and ova through epigenetics, and these changes will be transmitted to the next generation. So the observed heritability of type 2 diabetes mellitus is mainly through acquiring the same bad diet and lifestyle practices, and also partly through epigenetics. In epigenetics, the unhealthy diet and lifestyle practices results in modification of genetic material through epigenetics. That modification also happens in the ova and sperm, and that will be transmitted or transferred to the next generation. We conducted an unofficial survey among final year medical students, internal medicine residents, and practicing physicians regarding the same question regarding the type 2 diabetes etiology, which is more important. Majority in all these three groups felt that genetic was the most important etiology for type 2 diabetes mellitus, but this is totally wrong. The actual answer is lifestyle much more than genetics. What could be the reasons for this wrong perception regarding the etiology of type 2 diabetes mellitus among the surveyed medical students, residents, and physicians? One reason could be present day medical literature, which includes journals and textbooks, is more biased towards genetics in terms of number of publication and emphasis given. Then these textbooks and literature is not telling us that lifestyle is less important and genetics is more important, but the volume of literature or volume of text printed in the book is more regarding the genetics. This bias occurs because journals always favor novelty regarding the published articles. Lifestyle is an already established big etiology for type 2 diabetes mellitus. So researchers and publications are now more inclined towards molecular biology and genetics. But going through the journals and textbook, most of us may get a feel that genetics is more important. But this is not true. Textbooks and literature are never telling that genetics is more important. But we may get a feel that genetics is more important because of the volume of matter or material published regarding genetics. So take home message for this short video session is dietary modification and increasing the physical activity are the two crucial components in preventing type 2 diabetes mellitus. We need to prevent or stop the current epidemic of diabetes. Otherwise, this is going to be a big public health problem. We should give only less emphasis to genetics for genetics as the etiology or cause for the type 2 diabetes mellitus because its contribution is less and also it is something which is not easily modifiable. So there is no much use in going after the genetics as a etiology for type 2 diabetes mellitus. We should always focus on the root cause of type 2 diabetes mellitus, which is unhealthy diet and lifestyle practices. Thank you.